10 hidden signs you have thyroid disease. Hello and welcome to the channel. Today we're diving into a topic that's sneaky, misunderstood, and quietly messing with millions of bodies around the world: thyroid disease. And nope, it's not just about feeling tired. There is so much more to the thyroid gland than tiredness. Before we start diagnosing ourselves, because I know you will, let's quickly talk about what the thyroid actually does. The thyroid gland is a butterfly-shaped gland that lives in your neck. Super chill. Just hangs out below your Adam's apple. If you're a man, that is. It's small, it's unassuming, and it's secretly controlling everything. Okay, maybe not everything, but close. It controls your metabolism, which affects how your body uses energy. So, if it's off, you'll feel it. You just might not realize it's your thyroid causing the chaos. There are two main flavors of thyroid problems: hypothyroidism, when your thyroid is underactive, slow, sleepy, often misdiagnosed as just getting older. And then there is hyperthyroidism, when the thyroid gland is overactive. Everything's on overdrive, like your body's had 10 Red Bulls and no one hit the brakes. But here's the catch. Symptoms can be vague, weird, or just not what you'd expect. Because sometimes the typical symptoms of hypothyroidism can actually manifest itself in someone who's hyperthyroid and vice versa. So now, let's get into the 10 hidden signs you might have thyroid disease. Things that don't always scream thyroid, but might be waving a little hormonal red flag nonetheless. Number 1, you're cold all the time. If you're bundled in 3 sweaters while everyone else is in t-shirts, it might not just be the poor circulation on your dramatic flare. It could be your thyroid. When your thyroid is underactive, your metabolism slows down. That means your body burns less energy, producing less heat. So you're basically a human popsicle in a room full of normal people. Meanwhile, in hyperthyroidism land, you are overheating, sweaty, uncomfortable, and asking, is it hot in here or is it just my thyroid storming again? Fun fact. In ancient times, cold intolerance was a legit way doctors suspected thyroid issues, because medicine before labs was just about vibes and observations. Number 2, your bathroom habits develop their own personality. Yeah, the thyroid gland has a massive influence on what your your digestive system gets up to, because it is essentially the control room for how intestinal transit goes, either faster or slower depending on the state of the thyroid. An underactive thyroid equals rather constipation. Everything slows down, including digestion. People literally think they're just eating less fiber, but no, your intestines are on nap mode. Conversely, an overactive thyroid can lead to diarrhea or more frequent defecation. You're practically living in the bathroom, texting your friends from the toilet like, this might be my new address. Useful tip: if your bowel habits have changed for weeks and it's not due to tacos or stress, it's worth checking your thyroid. Number 3, you are moody, anxious, or kinda depressed. If you're feeling down lately, snapping at people who breathe too loud, before you blame Mercury in retrograde, consider this: your thyroid hormones do influence your brain. Thyroid hormones are crucial for mental health. Low levels can lead to depression, brain fog, sluggish thinking. High levels, think anxiety, irritability, insomnia. And here's the kicker: many people get treated with antidepressants first without checking thyroid function. It's like fixing a leaky roof by buying new furniture. Nice, but not helpful. Because thyroid problems are a great mimicker, they should always be at the back of your doctor's mind if you have any strange changes of mood and humor. It should be a routine test in any general checkup. Number 4, your skin is dry or oily in weird ways. If your skin feels like a desert, but your face shines like you just ran a marathon, it's not a skincare problem. It's an internal monologue. Yes, it's the thyroid, most likely. With hypothyroidism, you get dry skin, rough skin, pale skin. Your body isn't producing or circulating hormones properly. With hyperthyroidism, you might get sweaty, oily, and sometimes even itchy skin for no reason. It's like your skin can't decide whether it wants to glow or melt. Pro tip: if you're spending a fortune on moisturizers and still feeling like sandpaper, maybe ask your doctor for a thyroid test, a TSH test, which is the basic test that we do, thyroid stimulating hormone test, TSH. Number 5, your periods are all over the place. Yes, we're going there. Because your period is not supposed to be a monthly horror story with a total disappearing act. The thyroid and reproductive hormones are BFFs, best friends forever. When thyroid levels are off, your periods may become either heavier and more painful with hypothyroidism, or lighter or even absent with hyperthyroidism. This is typically the case, although vice versa can also be true. Some women even experience infertility or miscarriages due to undiagnosed thyroid problems. If your gynecologist or obstetrician isn't checking your thyroid as part of an irregular period workup, it might be time for a second opinion. For sure, if you have fertility issues, thyroid disease is one of the first causes to be ruled out. Number 6, your hair is falling out everywhere. Losing a few strands? Normal. Losing enough to knit a sweater? Might be your thyroid trying to mess with your beauty regime. Thyroid hormones help regulate the hair growth cycle. Too little or too much throws your follicles, the hair follicles that is, into chaos. With hypothyroidism, hair thins, especially on the scalp and outer edges of eyebrows. With hyperthyroidism, hair becomes fine, brittle, and falls out quickly. Even pubic or underarm hair might go AWOL. Hair tip: if your hairstylist comments on thinning, don't shrug it off. Get that TSH test done ASAP. Number 7, your weight is shifting no matter what you eat. If your weight won't budge despite gym selfies and oat milk lattes, your thyroid might be working against you. In hypothyroid people, mostly the problem is weight gain despite dieting. In hyperthyroid people, weight loss actually comes very easily to abnormal levels. You basically lose weight despite eating like a bear preparing for winter. Here I will add a caveat. Even if thyroid function is discovered as a cause of your weight loss, very often it's not the only cause. Other hormones, check that as well. Lifestyle, genetics, there are many causes. Weight is actually a polyfactorial problem. Number 8, your heart is doing weird stuff. Is your heart skipping beats, racing randomly, or just vibing way too hard at rest? With hypothyroidism, your heart rate actually slows down. You get more tired. Yes, there's that word again, the tiredness, the fatigue. There is often shortness of breath on exertion. With hyperthyroidism, you get more palpitations, racing heart, sometimes even chest pain. And you also get breathless on exertion because the heart is simply working at full blast when it doesn't need to. Some people even get diagnosed with arrhythmias before anyone checks the thyroid gland. And in fact, it's often the case that it's the arrhythmia, the abnormal heart rhythm, either fast or slow, that leads your doctor by the nose to your thyroid problem. Heart tip: if your resting heart rate is suspiciously high or low, especially paired with other symptoms on this list, yes, it could be the thyroid. Number 9, your neck looks kinda swollen. Mirror check. Do you have a neck bulge you have never noticed before? It's not a new muscle. It might be a goiter. A goiter is an enlarged thyroid gland. It can be visible in the mirror. It can be felt when you swallow. It can also be caused by iodine deficiency or autoimmune thyroid disease. More about that later in this video. Even without pain, it's a giant clue that something's off. Very often, people's goiters are diagnosed by other people who can see the goiter straight up. Pro tip: look in the mirror, tilt your head back and swallow. If you see a lump moving up and down, call your doctor, not your bestie. Get the TSH test done ASAP. Number 10, you are tired, but not in a normal way. Finally, the classic, the one everyone talks about. But let's clear this up. This isn't "I had a late night" tiredness. This is "I slept 10 hours and still feel like a zombie." Both types of thyroid disease can make you feel exhausted, but for different reasons. The hypothyroid type makes you feel heavy, sluggish, slow, and the hyperthyroid type makes you feel tired, but in a way that means you can't rest. You're running on anxiety fumes all the time. It's a case of tiredness because you really are combusting that engine at full blast. Okay, so let's recap. If you're cold, constipated, moody, flaky skinned, having period trauma, shedding like a golden retriever, weight fluctuating, heart palpitating, goiter sporting, or just tired of being tired, don't panic, but do consider checking in with your thyroid. And by the way, what causes thyroid problems? I think now might be a good time to address this. The biggest issue, particularly among females, is autoimmunity, when your body attacks you like a reality TV villain. Autoimmune diseases, aka your immune system's mean girls phase. Sometimes your body forgets who the enemy is. Put plainly, instead of targeting viruses or bacteria like it's meant to do, your immune system wakes up and chooses violence against your own body, against your own thyroid. Classic betrayal. There's no other way to describe it. The two A-listers here are Hashimoto's thyroiditis, where your immune system slowly destroys your thyroid, like a passive-aggressive roommate who leaves notes instead of talking to you. And then there's Graves' disease. Now, this is the name in the English-speaking world. In the European world, in French-speaking, German-speaking, possibly even Italian-speaking, it is known as Basdow's disease, Morbus Basdow in German, or Maladie Basdow in French, for example. The immune system goes more hormones and turns your thyroid into an overachiever on performance-enhancing drugs. Why does your immune system do this? We don't know. Maybe it has abandonment issues. Maybe it's bored. The science is still working on it. Number 2, genetics. Thanks, Mom and Dad. If you're wondering why your thyroid is misbehaving, go ahead and blame your family. It's tradition. Genes play a big role. If your mom, aunt, or that one cousin who always brings kale chips to the Thanksgiving has thyroid disease, your odds just shot up like your anxiety during an internet outage. In fact, thyroid conditions love to run in families, especially autoimmune ones. It's like a weird family heirloom nobody wants, but everyone gets. Number 3, iodine, the Goldilocks of minerals. Your thyroid is obsessed with iodine. It needs it to make thyroid hormones. But there's the thing, it's really picky about the amount. Too little iodine and your thyroid freaks out and makes a goiter. Too much iodine, also bad. The thyroid short circuits and possibly explodes. Okay, not literally, but chaos ensues. It's like living in a house with a roommate who can only eat toast made at exactly 2 minutes and 36 seconds. Anything more or less, and they spiral into a full existential meltdown. This is why thyroid problems are more common in areas where iodine levels are weird, like landlocked countries like Switzerland, where I live, or people who think seaweed is only for sushi and never eat it. Basically, people who are far away from the sea are more at risk of iodine deficiency, goiters, hypothyroidism. Number 4, stress, the silent saboteur. You knew this was coming. Stress ruins everything. Your sleep, your skin, your will to live, and now your thyroid. Chronic stress can mess with the hypothalamus-pituitary-thyroid axis. Whoa, that was a mouthful. This is basically the brain. Hypothalamus and pituitary areas are areas of the brain that participate in the feedback loop system that controls the thyroid hormone. When that axis gets frazzled for whatever reason, due to an infection, due to autoimmune disease, etc., your thyroid may underperform, overperform, or just spiral into hormonal chaos. Stress may trigger one of these spirals into chaos. So, this is why it's so important to manage stress in general. It can manifest itself in so many ways. And one of those ways is to basically have an effect on your thyroid. And this is a problem because it is your thyroid which is the big boss of your whole body's metabolism. Environmental triggers, nature's chemical warfare. Welcome to modern living, where your air, water, makeup, shampoo, and cereal may contain chemicals that whisper seductively to your thyroid, "You don't really want to work today, do you?" Endocrine disruptors. That's a great name for a punk band, by the way. Are chemicals that mess with your hormones. Some usual suspects are BPA, bisphenol A, usually found in plastics, perchlorate in water, and rocket fuel. Phthalates in cosmetics, especially fragrances. It's like your thyroid is trying to do its job, but your environment keeps handing it a hurdle to climb over. Life is not fair. Number 6, medications that stay at the pot. Some medications are known to completely disrupt the thyroid's function. Good examples are amiodarone, which is a heart medication with enough iodine to make your thyroid flip out. Amiodarone, I'm inventing names now for heart medications. Amiodarone is used for heart rhythm problems, notably atrial fibrillation. or if you're French speaking, fibrillation auriculaire, or for Flehmen in German. These medications, amiodarone and similar ones, are pretty useful, pretty effective, and so they're very commonly used. One of the side effects, however, of amiodarone is thyroid disease, so it's used with caution, especially in younger patients. Lithium, which is used for bipolar disorder, is known to have a major side effect with regard to the thyroid. It basically blocks your thyroid function. Interferon is an immune medication, but it has a disruptive effect on the thyroid, sadly. Number 7, pregnancy, the ultimate hormonal plot twist. I'm not suggesting that pregnancy causes thyroid disease, but I am saying that thyroid disease, if it's already there, can be exacerbated in pregnancy, whether it's hypothyroidism or hyperthyroidism. Either way, pregnancy is a thyroid destabilizer. It's one of those physiological states which prompts doctors, in this case obstetricians, doctors who look after pregnant women, to be extra vigilant, extra strict, so that the thyroid levels that we would normally accept in a non-pregnant state is no longer accepted in a pregnancy state, because we have to be more strict, because there is potential for complete hormonal chaos during pregnancy. So medication doses are highly tightened up during pregnancy for good reason. Radiation, a cautionary tale in sci-fi and medicine. Radiation to the neck, either from cancer treatment or a badly timed trip to Chernobyl, can zap your thyroid into oblivion. Even diagnostic imaging with high radiation exposures like frequent CT scans can increase risk over time. The thyroid gland is extremely sensitive to radiation. So in general, I have to say, when it comes to imaging of any part of the body, we are extra careful. We really think hard about it. Do you really need that X-ray? If yes, sure, we do it and take the risk, right? That something may get destabilized. And your cancer risk increases generally, but particularly your thyroid destabilization risk can massively or exponentially increase. We take the risk if the test is necessary. If it's not really needed, if it's not really necessary, we just don't do the test, because we must be holistic with regard to patient care. We don't want to discover something which is not really necessary to discover. It's a bystander problem, and then run the risk of destabilizing your thyroid gland. So imaging for this reason is done with caution. Thyroid surgery or injury is my last cause here. Now, for obvious reasons, if someone literally removes your thyroid because it's cancerous or because it's inflamed or it's injured, then yeah, of course, there's no more thyroid function available. Surgery to remove thyroid nodules, cancer, or even because the thyroid was staging a hormone protest can lead to hypothyroidism, obviously. This is normal. So, not rocket science. Sometimes we have iatrogenic thyroid disease. Iatrogenic meaning caused by the doctor himself or herself, or the surgeon himself or herself. It's because we have induced a thyroid problem because we could find no other way to treat the diseased thyroid. We had to remove it. So there you have it. All about the thyroid in one fell swoop. Questions are welcome. Comments are desired. Go on, ask a doc.